is drill the bone and whatever to get the tooth out, elevate the tooth out, or use forceps, pick it up, smooth it off and sew it off. Okay, so that's the way we do a surgical. So do we know what any of these things are? And it doesn't matter if you don't, because you know, it's not a test. Do you know what these things are called?
Cheek retraction.
Yeah, that's a Kilner.
Kilner.
I don't know why we have this for an elephant horse. You know, we never use that unless one gets dropped on the floor.
Is that
that's a Minnesota. That's a flap retractor. Elastic, and that's for using upper 8, so it looks pretty obvious what it would do. It would just pull the cheek and the flap right out of the way. You know, this is a Rose tongue retractor.
What was that one called?
Rose. They're all on here, so you can marry that up with that. I'll try to copy that off for you too. That's a Rose. This is a Roundley sponge holder. Yankees sucker. Lax tongue retractors or lax retractors, broad and narrow. Mosquito artery forceps. These are the modern towel clips. You know your boat by Parker, don't you? Mm-hmm. That's a Maltz, periosteal elevator, a Howarth, a Ward spoon, Cumine scaler or Mitchell's trimmer, your elevators, Coupons 1, 2 and 3, Warwick James left and right as you're looking at them, Cryers left and right, upper posteriors, Fickling's angled forcep, a bone file, which you can only use in one direction, which is towards yourself. Gillies dissecting, I hate the term rat tooth tweezers, they're actually Gillies dissecting forceps. Crowwood needle holder, and long straight, or just your straight scissors. They've taken, they don't use these ones on the trays anymore, they use these ones. And your Mayo scissors. Okay. And then your forceps. You've got lower hawks, cow horns, which oral surgeons never use, lower universals, lower fines. You know, these are your hawks, so the beak goes on the buckle, right and left. Okay, can you see that? The beak goes on the buckle of the tooth. So it's as you're looking at it, so the curvy bit to your left, just like it is in the mouth. Left and right. Upper, well there they are again. Upper, they're not upper universal, they're upper posteriors, upper fines, upper anterior long beaks and short beaks. Okay, so do you know where you would use those forceps? On what teeth?
Anterior.
Yeah. Including canines.
Yep. And those ones are just canines?
Oh no, you use them. Well, you could use them mostly on 4s and 5s.
Oh, okay.
These fines are root forceps. So your upper posteriors you'd use on 4s and 5s. I mean, you'd never put them on an anterior tooth. You know, it's the shape of the tooth that it goes on to. And then your molar forceps, which are on 6, 7s and 8s. But often on upper 8s, because they're single, because of the shape of the roots, you just use those. Lower universals and lower fines, and as it says, fines again are a root forcep. Lower universals you can use on any tooth, but mostly just from 5 to 5. And you'll be doing this with, you know, in the Aboriginal community. Your cow horns, which are for molars, and the same with the hawks. Okay. That's pretty much it. Pretty much lower molar roots, or let's say you're doing a surgical procedure of a lower 8, he's decoronated and split it and wants to elevate the roots out. That's what they're for. They're really dangerous instruments to use, so you've got to be so careful, because I've seen upper 7 roots amputated while taking upper 8s out. They're really, you need to be very careful with them. And then your Fickling angle forcep is just purely for just picking things up. So getting the tooth out, and let's say we're doing a surgical removal of an 8, way, so then they just use the mosquito forceps to get bits of tissue out, stuff like that. Your bone file, your gillies dissecting just to pick tissue up, and you use these all week. Your crowel wood needle holders, and then your scissors. These are non-dissecting. We never use them. I don't know why they're on the tray. This we just use for, to retract the tongue. Your amply sponge holder is just for prepping the patient. There's a couple of different prep solutions that you can use. Again, it boils down to surgeon's preference. Most of them use chlorhexidine with cetrimide 0.5%. It's an aqueous-based solution, so they use that. And then you've got your lax, and again, that can be used for retracting the tongue, or sometimes if they do unerupted threes in the palate, and they strip the whole palate away, he'll bend this. You can get malleable ones too. They'll bend that way. Hi, how are you? They'll bend that to just elevate or to hold the soft tissue of the palate out of the way, so that they can drill around and get the tooth out. How are you? Busy? Yeah. Now, these are your McKesson's bite props, small, medium and large. Pretty much we only use the medium size one. You've seen them used, I'm sure. And then your Minnesota. This is a modified Minnesota. That's a flap. They use that to just hold the flap out of the way. That's a very popular instrument. There we go.
Difference again?
Oh, the size of the blade.
So
these have been they've been used, you can see.
Yeah.
What happens when, I'll just get a tissue, sorry. And that you almost never see that used. So that's used, so then they can, get the couplins down and just elevate them out. So that's what they're aiming to do, is to form a gutter, small enough just to fit in a number 1 couplins. Then they'll either decoronate the tooth and split it and get the different roots out, the distal and then the mesial. And then, of course, you use it to expand the sockets when you're extracting teeth. That's the preferred instrument, number 1 always. And then you move up depending on what's going on, but pretty much just the number 1.
This is a mouth mirror.
This is a Bard Parker. This is a Howarth nasal respiratory.
These are the malts.
Yes, this is a Maltz.
And then you can start testing each other. Actually, Dr. Ricardo's got a clearance.
This
on
is a
small.
Ward
You should go
spoon.
and watch that.
Oh, wow.
This is a Cumine scaler.